Now why am I going downtown? I'm going downtown because I have a disease that 1 in 10 men get, and I'd never heard of it. After 36 years nursing, I'd never heard of this disease. So now I have to go downtown and be injected 3 to 8 times. And if that fails, I need to have surgery. So I'm not going to keep you in suspense. What I've got is Peyronies disease. About 4.5 months ago, I was making love with Kitty and I had trouble getting in. And it turned out that my penis had bent 35 degrees towards my belly button. This completely freaked me out. There was no indication it was bending, it just bent overnight, and I didn't even notice until I tried to make love to her. And it turned out that I couldn't deal with it, and I wouldn't even look it up. I completely freaked out. This was an attack on me, on a deep emotional level. Anyway, Kitty looked it up. So it's Peyronies disease. It's non-fatal, and 1 in 10% of men develop it. Usually thought to be related to trauma. It's scarring of the penis, and it causes contraction, and there you go. So I'm going downtown to the men's sexual clinic to have an injection into my penis today. That was absolutely fine, but also terrifying. Basically, the injects 3 times local, which would be lidocaine, and uses a 27 gauge needle. You don't really feel it. The worst part was actually pulling my foreskin back. Because of the fear I had a very shriveled penis. Almost like when you get in the ocean, it just completely tried to hide. And yeah, he did feel the plaques, and he injected about 50 times with a tiny amount of verapamil. And he didn't bandage it up. I have to do exercises once or 3 times a day. I have to get myself erect and pull it away from me, and also push like that. So we'll see how it goes, but my next appointment is on the 8th of July. Meow, Huples cat, and today I'm having surgery on my penis. So I'm at Queen's Park in College. I'm just going to head a little bit north and go to Women's College Hospital, which should amuse the childish because I'm going to a women's hospital for my procedure. Now, my surgeon also does mostly gender reassignment surgery, so I'm hoping he gets it right today. You will see why I'm having my surgery, what it means for the men in your life, and the men who are men, why you should take this sort of thing seriously, and how I've actually been treated to actually get to the point of operation, which is kind of fascinating. Anyway, I hope you enjoy this. If you like this, give me a thumbs up and consider a subscription. Later, if I live. Having checked in, this is the waiting room. People waiting for day case surgery for hips and women's issues and mine. This is me in the waiting room. I had my N95, they insisted I take it off. I said no, so I got a surgical mask on top of it. And there I am in a surgical mask with my booties on in the recovery room being well observed. Huples cat. Excuse my voice, I was intubated yesterday for day case surgery. I'm actually doing great, and thank you all so very, very much from the bottom of my heart for all the well wishes and happy thoughts. I'm sure that had a lot to do with it. I have done, so far, incredibly well compared to what was expected. But I'm just going to talk about the journey quickly. Around about January of 2020, I had nothing wrong with me, and I have a reasonably active sex life. Not as much as I would like, probably more than Kitty would like, but reasonably active. And I couldn't enter her, and we didn't realise what the problem was, and she noticed it. My penis had bent like this, and I freaked out. As I said, I couldn't look it up. She looked it up. I was convinced I had cancer and was going to die. And it turned out I had Peyronies disease, which 1 in 10 men get. Now, after 35 years as a nurse, I've never heard of this disease. Sure, I've seen odd-looking penises, but I'd never heard of this disease, and 1 in 20 men get it. So please make sure that the men in your life know about this disease and go and get treated if they have it. It's not a cause to be shameful. So I trundled downtown every month or so and had injections for about 6 courses. I didn't do the full courses because it wasn't working at all, so what's the point? And we listed me for surgery. Then of course COVID waves kept coming, so day case surgery was cancelled. But on top of that, I could have had it done a lot sooner than the 18-month period I'd gone through. But I chose not to have the surgery done until I was double vaccinated and had a good 6 weeks after the second vaccine. And I think my surgeon appreciated that. He's a really good guy. And this morning I emailed him a bunch of questions, which he's been in surgery all day so he hasn't seen. He called me on his lunch break to make sure I was doing okay. That's good service. And it's all free. The injections weren't, but everything else is. On the 10th of August I was phoned at a mutually agreeable time, and a nurse talked to me, an advanced nurse practitioner, and we talked about what I was going to have done and my health conditions and all the rest of the stuff, and that was great. And she asked me if I wanted to be part of an anaesthetic study, and I said sure. Depends what it is. What is it? She wouldn't tell me, but she said she'd get the anaesthetist to call me, so I immediately figured, Anyway, the anaesthetist immediately started talking about how she was going to do the procedure. She didn't talk at all, or say at all, at any time. It was a study, which is illegal and a breach of professionality. But as soon as she muttered the words, "we're using a spinal anaesthetic," I said, "No, you are not using a spinal anaesthetic on me." She was, "Well, I'll just explain the procedure." I said, "There's no point." So she carried on. Her English wasn't great. And basically I said to her, "I'm not having a spinal anaesthetic. I'm aware from an economic point of view and a population health point of view, spinal anesthetics might be a good idea for this type of surgery, but if you are operating on my penis and I am conscious, I won't be sitting down on the table, and I'm not going to let you put a spinal needle in. I consider them to be risky. I know they're used a lot, but I'm not going to go into a hospital for day case surgery and risk having a resident shove a needle into my spine. I wanted to be out for this." And it was interesting because the anaesthetist on the day of the 16th when I went in, I actually worked, though he didn't remember me, at my ex-hospital soon-to-be, Sunnybrook, and he's a great guy, and we had a great talk about a bunch of issues and stuff like that. And he said, "There's no way I'd have a spinal for this either." I said, "Well, yeah." So I didn't have a spinal, I had a full general anaesthetic, so I was literally intubated yesterday. You probably can't see it, but at some point, probably during the extubation, I have no memory. They give you memory suppressants, by the way, during surgery. Takes away your short-term memory, and I'm grateful for that. But at some point I went like, enough to bite through here. So something went wrong, but I don't remember it. Now on the 13th I went down to actually get my stuff done, my COVID test. We decided not to have it done up here in Newmarket because they might not get the result, and if they didn't get the result, they weren't going to operate. So you have to have a COVID test within 3 days, or they will not operate on you for day case surgery. Now each hospital has different rules, so I found that kind of draconian, but interesting, because a lot of people coming for this type of surgery are coming to see a specialist. So a lot of us don't live in the downtown core. So they gave me this old bump, and literally from the 13th of August I was supposed to isolate as if I was exposed to a positive COVID. It tells you how to do it, but again it's from the end of 2019, so I'm not going to show you it because it's old. And I knew what I was going to do. But what they wanted me to do was to be picked up by Kitty after the test, which I didn't. I used Transit. Transit's empty, and I used an N95 mask. And it's a long way for her to come. And I went down on Transit, which I wasn't supposed to do. She's supposed to drive me with me in the back of the car, and both of us wearing masks. Surgical masks, okay? You know my opinions on surgical masks. In close proximity to people who have COVID, I would much rather have an N95 on. And from then on we were supposed to sleep separately, toilet separately, and use different foods, and basically isolate, and I was not to leave the house. So, long story short, I did what I felt was reasonable. I didn't actually go shopping or any of that stuff, but I did walk the little dog, because why not? I'm not in contact with people, and people transmit the virus, not dogs. And they sent me this. And what I thought was really neat, they said, "You won't hear from us unless you're positive," which I thought was great. So I went into My Chat Women's College, which was a really simple process. I've tried with the Sunnybrook one. Ours sucks. Theirs was like, boom, straight in, got my chart, could read my chart. So the doctor was able to email me, the nurse was able to email me, and I was able to see on the morning of the 14th of August that I was negative for COVID, which upset me because that meant I had to have the surgery. And I've been bricking myself for this. And really, to be anaesthetizer in your ICU nurse, to have your penis cut open and scar tissues removed. Anyway, long story short, so I went down there by transit. Kitty was going to drive me. I said no, because you'd have to come back and go down in rush hour and come back. Like, what's the point? I can isolate on the transit system, the GO train, and the TTC. The carriages are empty, and I was able to do that just fine. I have a video coming up showing just Queen's Park, the area I was in, and that's just a here's Queen's Park, Toronto area video, so it's not really part of COVID, but it's what I did to fill in the time before I had the surgery. I went in, immediately greeted, immediately told to take my mask off. I immediately said, no, I'll keep this on, but I'm happy to put your mask on top of it. Oh, that's fine, they said. I've run into much more aggressiveness at Sunnybrook about this, but I'm not taking off an N95 to put on a surgical mask, right? I'm just not doing that, it's stupid. Anyway, whatever. So I ended up with 2 masks, as you saw briefly, and I needed desperately to go to the washroom. So I walked down an empty corridor and spoke to a really nice girl, and she took my details, checked me in, all the rest of the stuff in about 15 seconds. And she said, no, go to the toilet over here, hardly anybody uses it. So I went to a private toilet, had an enormous bowel movement, which was a good job because I was about to have a general anaesthetic. And I went upstairs and I checked in and they took my health card and my details, told me a little bit of stuff, made me sit in the waiting room, you see, and then the nurse eventually came about 20 minutes late for my appointment and took me in. I was stripped, except for socks. They'd said, and this is what's so cool about this, they told me pre-operative instructions. Bring warm socks to wear in the operating room, it gets cold, and recovery, and a whole bunch of detailed stuff. Like no confusion in anybody's mind what I needed to bring, what was going to happen. And I loved it. It was brief, it was simple, it was wonderful. They told me to wear loose briefs and loose trousers. But because my doctor's mostly gender surgery, the other instruction was not to wear high heels. I guess if people are transitioning, they like the new identity. And it's not a great idea to go in for that type of gender surgery and then try and walk on high heels. Having done that, put my stuff in the locker, they then moved me into another separate waiting room with tons of space. 1 or 2 people came in. I went into a private room, saw a nurse, got my blood pressure done, which was elevated, of course, because I don't like hospitals being a patient. It bothers me. And I'd also missed my dose of blood pressure medication that day. I told Denise if I was doing that. I probably didn't need to because I'd actually forgotten I didn't take it the day before. But anyway, I'm sloppy with it, but I keep an eye on it. And then they sent me back to the original waiting room. So I'm sitting in the original waiting room wearing pajama trousers, my socks, a gown that completely covers me, and boots on the socks, and sat there for about 30 minutes waiting to be called in. I was called in, I was put into part of the surgical day case unit, and the nurse came and said hi, I never saw her again, and then my doctor came and he said, hi, how you doing, and blah blah blah. We had a good chat and he talked about the procedure and all the rest of it and asked me if I had any questions, and you know, we had a good chat. And then he came back with his resident and introduced the resident, and then he left, and then the anaesthetist came, put my IV in, and I felt very comfortable and very confident in both the efficiency and what was going on. So then the doctor comes back, which this really blew me away, and says, come on, let's go to the operating room. And I walked in with him, which I found very bizarre, to be frank with you. I in my mind, I work in a trauma hospital, I expected stretchers and porters. No, he just walked in with me. When I walked in, they asked me to completely strip apart from the stocks. So I did. I don't have a problem with it. There's 2 female OR nurses in there and the 2 male doctors, it turned out, the anaesthetist and my surgeon. But having been in that position, you don't look at people's wobbly bits and you can care less, so it doesn't bother you. If I see naked people outside of the hospital, it really, I go, ooh. But in the hospital, like honestly, it's like looking at bread, whatever. So I was comfortable with that, and they covered me up with a warm blanket as soon as I lay down and got ready to anaesthetize me. We had a few jokes. He said, no, you know, because they keep asking you your name and everything and what you're having done, so make sure that it's the right patient. And with this sort of surgery, it's important not to screw up on that one. Yes, you're going to make my penis twice as long as it is now and not make it so bent, which actually caused a big laugh. I really didn't expect the general anaesthetic procedure to go the way it did. I was kind of nervous about it. You know, they're putting you to sleep. I wasn't highly anxious actually. By that point, I was actually totally chill. It was just like being at work. I was just relaxed. I was comfortable, confident. I think for most people, you'd still be very terrified, spread eagled in this operating room. I mean, I've been in a ton of operating rooms. So it was interesting that as soon as he gave me the anaesthetic, I immediately, because it was hydromorphone, which is a narcotic, I immediately felt kind of relaxed, really relaxed. Time slowed down, I felt really good, I wanted to talk, but I know enough not to. It's just going to be gibberish. And then he said to me, do you want to know what I'm going to give you? I said, no, it's fine. He goes, well, yeah, it's going to sting a bit. I said, yeah, I know it will. Because I'm pretty sure he gave me propofol and rocuronium. And that was it. And my next memory, I thought, was in the recovery room, but it wasn't. There was another memory in the recovery room. I woke up with the nurse shaking me with a big red beard. He looked like a hobbit, and I'm like, what are you doing here? Because I thought I was in the operating room. And he said, breathe, breathe. And I had a face mask on. So I immediately, being me, turned on my other side and looked at the monitor to see what my O2 sat was. And it was 94. So I did some breathing. I didn't verbalise, and I was pretty out of it. And it went up to 97. I was comfortable with that, so I rolled back on my back, and he said, oh, okay, good, and walked off. I then know I stopped breathing because I was just so relaxed. So that's what I want to say. When you get the anaesthetic, there's no fear, there's no feeling of being forced into unconsciousness. You are very much comfortable with it. And when I lay in the recovery room, I just went, oh, I went back to sleep and stopped. I could feel myself not breathing. It didn't bother me in the slightest. So I think that's why people need to trust nurses a lot more and be very confident in the team that they pick for any type of surgery, even for day case surgery. That was my first memory. The first memory that came back was actually him coming up and talking to me and taking the mask off, and we had a chat and all the rest of it. He told me what was going on, and he goes, "Would you like some water?" And I said, "Yes, please." As you probably hear, it probably was a difficult intubation. I'm wondering if they couldn't get it in, because I know I went like that. I know I did, because of the bite here. I never said anything, but I've seen that happen. Like, they're not fully anaesthetized when you try and intubate, and they freak out, and then you have to like kind of wait, because they're not breathing but they're fighting you, and then you have to put them down, and it takes a bit of effort. So it could have also happened on extubation. I've seen that happen when they take the tube out. The tube goes from there down to here, by the way, and you're on mechanical ventilation. So that was cool. And I said, after the drink of water, which was great, they give you little horrible non-recyclable cups, tiny amounts of water. I said, "Oh, I need to go to the washroom." He goes, "Oh, that's because we took the catheter out. They put a Foley in while you're anaesthetist and take it out before you wake up, just to make sure that they can see the urethra so they don't cut it. That's why the Foley's in. It's there to make sure that the penis does not, when he's doing the surgery, does not miss the fact there's a urethra there. They don't want to touch nerves, blood supply, or urethra, just the scar tissue." So I said, no, I've been feeling that for half an hour. I need to go to the toilet. So because it's my first time out of bed, I swung myself slowly up on the bed and started swinging my legs like he should have told me to do, because postural hypotension, dizziness on movement, is common. And then he's like, "Well, do you need a wheelchair?" And I said, "No, I'm fine. But can you just make sure you're with me, because I am stoned." He didn't accompany me into the washroom, which is fine, I guess, but I think for the first pee, I as a nurse would have been in the washroom with the door open, ready to intervene if he collapsed. Like, I wouldn't let him go into an ante-room and a toilet with both doors shut on me outside. No way. But anyway, privacy, right, has a place, but not there, I didn't think, not for the first trip up. Anyway, so I went back, it was fine, and I had this big dressing on me, I didn't know what it was, I didn't really look. And I went back to bed and gave her some more water. Then they mixed up the call to Kitty and told her to come down as soon as I was awake, which was a daft idea, because then we had to wait an hour before the doctor come out and see me. He saw me, looked at it, did some dressing. Now what I want to say is the dressing was done wrong, and I wasn't aware of it because I wasn't fully functional. The dressing was a cling dressing over the glands of the penis, because I no longer have a foreskin, right? And it's over that. It's also over the suturing at the base of the glands. Or the resident, when they put the dressing on, they're supposed to secure a bit of tape. He went like that, all the way around it with plastic tape, and I didn't realise until the next day. That can cause you to constrict and have major problems. So no dressing should be so tight around a surgical wound that the surgical wound can't easily expand without any problems. It's much better to redress it than to deal with that. So I sent him some questions. Like I said, he phoned me anyway before he got the questions, and yeah, they prefer the ribbon gauze comes out tomorrow. He never mentioned I had ribbon gauze, but it'll be fine. And he says, yes, it's all the extra skin on my shaft. I have to make sure it's constantly pulled down so the glands are exposed, which is why I'm not in a lot of discomfort, because my shaft of skin of shaft, like, this is my penis head, which is now open for the first time all the time except during intercourse, and my skin, and the skin of the shaft has now gone up like this. This is retracted. My penis does not like pain. I do not like pain. It is retracted. So I'm going to have to manipulate that and do stuff like that, but he said I can wait a week. So I'm going to have trouble. I also got special underwear from Tentree, which I won't bore you with. It's supposed to be the world's softest underwear, and it's working. I no longer have a dressing on. I had to reuse the pad I had because I didn't have enough pads. No graphics coming up, but there is a picture of blood-stained bandages for those who are very, very, very unable to cope with anything. That's the cling around the glands that have been circumcised, and this is ribbon gauze that's supposed to be around the base of the glands, over the suturing where they used to get into the penis. And yeah. Thanks for indulging me. I know it's a bit long and boring, and I'm still frankly a little bit stoned. So I mentioned the fact the surgery didn't quite go as planned. I don't know exactly what happened, but they ended up doing a nerve block into the perianal area, which lasts about 4 to 8 hours to completely deaden pain. And he told me that I'd have a week off, and I could have sex after that, and I could have Tylenol. When I woke up, he told me, put in oxycodone, and you can have Tylenol after that to give me 5 days worth of oxycodone, and I wouldn't be able to have sex for a month, and he's very specific about that. He said the surgery was way more difficult and involved than he expected it to when he went in. So we started out bent like this. It actually went 90 degrees, and I actually sent some kind of rubbishy pictures to him, and he said to me, "Your bend was 90 degrees." I said, "Yeah, no, I told you." He goes, "Well, actually everybody says that, and it never is." He goes, "Yours was," and it was completely bent, and so whatever happens here, I'm happy. My penile length is normal to average to big, and I probably lost about this much at the shaft length, maybe this much, which is actually quite a kiddie okay. He's really strict about this. He says don't do any form of sexual activity for at least a month. Be very careful. Like, he did a lot of deep, I think it was a really open deep surgery he had to do. So yeah, there you go. That was my journey into anesthesia land, and I know it was very long. But if you have any questions on this specifically, ask me below. If you have any questions ever on day case surgery or operative surgery, let me know. I found it really interesting to be on the other side of the gurney. I don't like it, but it was interesting, and it taught me quite a bit. And hopefully you've shared some of that, and hopefully this will never be of any use to you, because you will never have to have surgery. Toodles.
This has been a Dog in a Bonnet production, 2021.